Что будет, да? Да. Если перейдет пальцы, говорю, поднимемся дальше, вместо клуба, сразу пришли. Это кто поставит это? Бизнес? Плохо работает. Что поставили вообще? Зачем это надо? Это коричневый только. Да сидите элегантно, мне иностранцы будут. Иностранцы, зачем они, а? Зачем они, а? Вам это хорошо, иностранцы будут. Что там? Еще 10 поставить. Не знаю, надо поставить. И мне кажется, фотку, да? Это нормально, ладно. Просто не знаю, что ты. Вот это зачем, вот это сколько. Это зачем? Зачем? Это ладно, это нормально. Это нормально, это нормально. Это зачем? Зачем? Я не описан, это какие вещи, потому что а что тут?
Я думаю, что сегодня все пошло. Спасибо. Да, до 10-го я.
Здравствуйте еще раз. Это у нас студенческий актив, в основном старосты. Второй курс у нас уже знакомый, да? Четвертый курс еще не знакомы. Эмар и я из Арабских Эмиратов. Задавайте вопросы, которые вас интересуют, да? Задавайте вопросы, которые вас интересуют по здравоохранению, которые у нас, например, к примеру, да, в Арабских Эмиратах как происходит медицинская помощь, как у нас в России, да, она организована, как она организована в ваших странах, да, то есть эти вопросы, которые вас интересуют, пожалуйста, задавайте.
Все, не работает?
Работает?
Работает.
Все работает? Нет, вот эти работают.
Если работает, тут тоже работает. Тот микрофон работает?
Нет, не работает.
Вот.
Просто у меня презентации нет, поэтому, наверное,
Нет, это просто...
не надо ставить. So it is my pleasure again to meet you after a long time. Some of you, I think we just met there. And I hope that our meetings will continue again and again. And I will be able to deliver to you the latest information and advances in the field of medicine. And I will be very happy to answer any of your questions about your career, about your degrees, about your next studies, postgraduate studies. It will be my pleasure to answer any of your questions. So you are here mainly from India and Egypt. Any other countries? Polonia? Colombia. Okay. Somalia. Where? Saudi Arabia. Syria. Any other countries? Iraq and Egypt. Yes? So about Colombia, I don't know. Maximum I reached till Mexico. I've been in Mexico till Colombia. I didn't know. I have operated many patients from Colombia. They came to my clinic. Recently, even I operated one lady from Colombia. They are all very beautiful and very nice people. I respect. I like them. So that's what maximum I can say about Colombia. Regarding, I just mentioned there about the study here, and unfortunately, what I heard that they removed this university from the recognized universities, and this today was my discussion with the higher management here in the university. And they said they have contacts with Ministry of Education in Egypt and in other countries maybe, but mainly in Egypt because they have here a lot of students from Egypt. And the message was that I think this is financial issues, this is political problems. It is not related to the university itself. It is related to the companies who are dealing with the university here. This is the main issue as I understood. So I think they are solving this issue, and this university will be back to the recognized list of universities. So don't worry about that. Anyway, you started. I think you are recognized. Nothing to worry. And the most important, what you are going to do after you finish, and how, what is the volume of information you have, you gained from this university for to continue the subspecialties. I have uh, I have seen 2 or 3 doctors working there with me, and they are pretty doing well. They are doing well. They are doing well because they said it good. One of them is orthopedic surgeon. I know him. He's my friend. He finished 5 years here. So if you want to continue here, that you need to go for PhD. Never stop with ordinatura, whatever it is here, because in your places, postgraduate ordinatura 2 years is not recognized. So you have to go for PhD. PhD means at least 5 years. Then depends what specialty you like to go, internal medicine or surgical. Anyway, it is like 5 years. It will never, you'll never be a good doctor if you do only 2 years. 2 years is little time to be a surgeon, for example, or to be like obstetrician, gynecologist. Maybe some of you want, especially for female. Yes. So this is my message and my advice, and this is the system in the world. I think in Colombia is the same. Yes. How the certificate from Russia is recognized?
Actually,
With this deep breath means that some problem is there.
actually, I don't know. People we don't have many people from Russia to work in Colombia. If we fly Colombia, we stay Colombia, and the people who go out of Colombia stay out.
So you are planning to stay here. Okay, so all the best. And anybody wants to work, and anybody from Saudi here, from Saudi Arabia? Yes. Saudi Arabia, the system same like in Dubai. I work in Dubai. Even in Saudi, more complicated. But the good thing in Saudi, I have colleagues in Saudi studied and they are graduated from Russia. The good thing in Saudi, if you have PhD, you get a consultant degree. So the degrees are there, GP or general practitioner. The second one is specialist, specialist 2 types, A and B. And the third one is the highest, is consultant. So if you have a PhD from Russia in Saudi Arabia, you will be working as a consultant. In Dubai, in UAE, never, only specialist. That's why for me to work as a consultant, I had my further studies and master degrees from United Kingdom to be a consultant and head of department. Yeah, so about my work there, I am a consultant urologist, head of department and head of urology department in 2 places, in 2 hospitals. I do my duties every day from 9 morning till 10 evening. We do a lot of different surgical procedures in my field, kidney surgery, stone problem, which is very common in that part of the world because of the dehydration and the hot weather. We do a lot of advanced operations like using laser and minimal invasive procedures. Uh, and and this is the daily. We have only one day off, and the rest of days from morning till evening work. So the system is like that. If you want to be a consultant, you have to work hard. And we are doing pretty well, and we are doing also complicated procedures, complicated operations for let's say for prostate problems or for cancers. We do bladder cancer operations, we do prostate cancer operations, and this is very common. Other part is andrology. It is related to the man health, which is related to infertility issues. If the man cannot couple married and they can't make children, and at the end they will come to me for these problems, and I take a care about the man because I am andrologist also. So the subspecialty is urology and andrology. What andrology means? Andrology means man health, anything related to men's health. So even nowadays in USA, in Canada, they started to open a clinics, what they call them men's health clinic. So it is subspecialty. Uh, and there are a lot of patients suffering from these problems, and we are doing well, and trying to help people maximum to have children and to have a good life. So if you want to ask anything, I'm very happy to answer any question about healthcare and system organization, about degrees, about anything. But now if I continue watching there, my neck will be pain because it's so any question?
Yes. Which specialty you come from graduation?
That depends on you.
No,
Because see, you are near 2 or 3. Which course you are studying? Second. Second, maybe next year or year 4, you will start to understand where you want to go. Now, still maybe time early to think about that, because you need to see surgery, you need to see internal medicine subspecialties. Then you will be able to select where you find yourself. You find yourself as a surgeon, not because your father or your mother go make surgery. No, don't listen to them. See where you can do what is best, what is better for you, to be a surgeon or just a pediatrician, for example. That you will decide after. I cannot tell you go to this because this is your own choice.
study for 4 years. Technology
Ophthalmologist assistant. Okay. They have optometrist. You can go for, but this is not a medical university. This is, I think, subspecial. This is specialty in like a technician, or you don't need to be a doctor for that. But if you decided to go for medicine, maybe because you have experience in ophthalmology, you can go for ophthalmology, for example. It's a good specialty. Why not? I don't like it, but maybe you like it. But how is the situation in Somalia? Now it's not good. Good now? Okay, I hope. So for our Egypt friends, any issues? Except recognition of the university? What the plans? You are planning to stay in Russia, or you want to go for specialty there in your countries? In your country? In your country? Another country? Like Germany, for example? So you have to study German from now. Okay. Any other things? Any other issues? Yes. Yeah, it is same. Dubai, Saudi, all Gulf areas same. If you want to go work there, you have 2 exams: one prometric exam and one verbal exam. You finish one, you'll be eligible to go for second one. So yeah, I think yes. I think yes. They have the World Cup of the football coming next year. So, and I have, when I came here, I had my transit there in the Qatar this one airport. It is really good, nice, and Dubai first, Singapore, yeah, Singapore is the best.
Russia sharing between Russia and Libya. There's every country want to work in prison.
I think the majority of European Union, they will recognize only the basic, the MBBS. Regarding specialty, I'm not sure. For some countries, they will recognize if you have PhD. Other countries, they will tell you, sorry, you have to start from the beginning. It happened with me in Canada, for example. When I lived in Canada, they asked to start from the beginning. So I told them, thank you, I don't need that. I came back to Dubai. So every country has its own system.
You went there for work or for study?
No, actually, in like 12, 13 years before, I just migrated to Canada.
You went when? After years before this study.
Canada is, if you can do the exams, there are 4 exams in Canada. You have to study very hard. It is not easy. You think it's easy?
No, thank
Yes, it is not easy for people who don't. But if you are fresh graduate and you can prove yourself there, you will get the license and you can work as a GP. But if you want to work as a specialist, you have to go there only because they don't recognize any specialty from the world. Even from United Kingdom, they don't recognize. They recognize only Canada and USA. That's it.
I'm just planning after the university work just study.
Yeah, why not? Yeah, they will accept you. They will accept you if you do the basic exam. They call it MCCEE. And the second part, MCCQI. You know what that means? Like PLAB in UK. So Medical Council of Canada Evaluating Exam. This is part one, part two. Then you go to qualifying exam. Medical Council of Canada qualifying exam, one and two. Now they have the fifth exam. So they will, it is not easy in Canada. But some people who pass the exams and they work there. For me, because I went when I am already was a specialist, I was not student like you. So you can go and you can start from the beginning, and I think you'll get it. Why not? And if you work in Canada as a doctor, you have a very good income, a very good position. And Canada is good. Yeah, I have my house there, my citizenship, everything Canadian. In city Edmonton, if you heard about it, in Alberta, yeah, province. I spent some years there, some time, but to be honest, I didn't like because I am specialist. For you, it is different situation. No, for you, it is different. You can work as a GP. For me, I cannot go back to work as a GP. Yeah.
So if can I include the people maybe it's not for all students where
Where to go? To Colombia.
in Colombia we don't have my system. So it's not option.
It's not option. Okay, come to Dubai, or stay in Russia. Continue your postgraduate.
Maybe in another university here we don't have something.
They don't have here. What is your specialty?
I want to be pediatric.
Pediatric.
Yeah, and after that neonatology.
Pediatric food is for elderly people. Yes, care for elderly people.
Would be
Yes, neonatology, it is really good thing and it is required everywhere in the world. So if you have neonatology experience and postgraduate certificate, you can find job anywhere in the world.
more many
Yes, that's good. That's a good point. Maybe with your colleagues go to Egypt. Why? No one want to go back. What about our Indian students? I think they all they want to go back. Yeah, see, I know, I know. But after that, they will go back. Then they will try to come to Dubai.
I don't think so.
No, You don't like to come to Dubai? Because we have a lot of Indian doctors and they are doing well. By the way, I had membership in India. I trained in India. You know, anybody from Gujarat? Okay, very good. So you know Kidney Hospital in Nadiad? Yes. You know that place is my place. Yes, where I spent long time there in Nadiad, and I lived in the hotel opposite. Well, see. So next time I will see you there when I go. So I traveled to India many times. I have good Indian friends, big names there in India. They come to visit us, and sometimes I go to visit them. We change experience, and they're doing good. India is very good medicine. I like it. I like because there are a lot of population, and the doctors became very good trained. Yeah. So I like. That's why I think for Indian doctors, if you find a position there and you work there, you don't like to go to another place. But for doctors who started outside, they cannot go back because there are a lot of competition and they cannot continue there. So, what about Syria? Who's Syria here? What is the future in Syria? Huh? No, situation can change from day to day. We don't know. Yeah. So we hope that everything will be good. We have Dr. Nasser here from Syria. He's a neurologist, but he doesn't know. He is here visiting only. So, any other concerns? Any other questions?
Да, вопрос такой насчет работы в России. Вы об этом знаете, да?
Хорошо, вы хотите продолжать по-русски или по-английски? Мне безразлично. Все понимают русский?
Это просто сложнейший.
Хорошо, давайте лучше тогда по-английски, чтобы все поняли. Я могу поговорить хоть на немецком, без проблем. Вы хотите на каком?
Да, я вот первый языков говорю.
А?
Я по 5 языков говорю. Как вам удобно?
Не, давайте лучше let's talk English because here some students they don't know Russian. Okay? Yes.
I
What?
was asking about work here. I have a lot of friends there. They just take the board was here. In general medicine, they start to work like sanitary and in the hospital. But now they told me like the different things and just came from after getting translated after the theater. Do you know about that?
Yeah. Sanitar, you know what sanitar means? Cleaner. Cleaner.
Yeah.
So why you want to work as a cleaner?
No, but like yeah, and operation room is different from sanitary.
No, cleaner and technician. That is OT technician called.
They are working as a whole. The operation after operation they just clean what's there.
Yeah, it is a cleaner.
Yeah, but in operation.
So for what? For what purpose? Why they want to do this job? For what?
Why they go?
Yeah.
This like not they work on the water or the income, but
Income is very low for this job.
yeah, I thought at least but say today about nanny like the doctor asked him, okay, you can work here like cleaner, but I can like make you like how to say assistant. You can assist.
So, surgical assistant, there is no. It is good developed in USA, for example. There are a lot of surgical assistant jobs. You go and you know what you need to do, but here there is no surgical assistant system in Russia. Sanitar, cleaner, yes, but I don't think this is good option for you. Because first of all, if you are thinking about salary, there will be very little. And if you think about experience, nobody will give you experience in this. This is my own opinion. I don't know if I'm right or not, but I think like that.
But like now, I go to the 21 hospital and to hospital like you can take it Sunday, Monday. I go there to the good at night, like on the doctors, they even I don't know how to say, but they are just certain there was someone to help him like that. So the doctor asked me like if I can or like not since that right now in the operation room, so I will go there just to get this money from the experience.
Yeah, if you have your own good relations started because you are going there for night duties, for example, and sometimes yes, they are in shortage and they need people to hold to help them, and why not?
And I was asking about like if you know information about that. Is that real application? Is that real from the airport or from that of my
No, that you can go any course for this kind of work. You can go from third course, for example. Before that, it is difficult for you. But from third course, you are close to know some basics about surgery. But from second course, it is difficult. And if you have your own experience in that, and you went to the hospital and they give you chances to assist them in surgery, it is a great. Well, that is good. That is good. That's good. And when you become surgeon, you will be understanding more that what is this anatomy and all these things. Tomorrow we have lecture about surgery and for fourth course. Anybody from fourth course here? So tomorrow, 8:45. Salary in Canada? $100 for 1 hour. And if you are a consultant, you can reach up to $250 per hour. Gulf countries, different from country to country. You want to know my salary? It is it is a good salary actually, and it is high salary, but the lifestyle there is expensive. It is not like here, for example. So whatever lifestyle you are doing, you spend more or spend less, but the salaries for doctors are good and high. You want to know how much?
You was so many countries. Which of these countries you like?
I like Russia. You don't like Russia because I was like you exactly in your places here. I spent my after school. I came immediately here, and after I finished, the only one country I can memorize good it is Russia. I studied in other city in Saint Petersburg, and whenever I have chance to travel or to just to take rest, I come here. I don't like Canada. I don't like US. I don't. I like only one of, let's say, one of the favorite places for me, Saint Petersburg, and yeah, I like it because I lived there 11 years. Yeah,
I think it was a big difference between living in Ufa and
Ufa is more quiet city, and this is cheaper and everything. Saint Petersburg is a crowded. It is same like Cairo and let's say somewhere else.
Много,
Hmm?
много души.
Дождь много. There. Yeah, weather is there not very nice. But if you live there with the time and you know everything there, when you know where to go and where to live, you after some time you'll find it is good for you, good place, especially in young age, you know. But if somebody will come to live now, for example, he will not like it like me, how I like it. I have been almost everywhere, but all the time something attracting me here that to come and see and to to reverse the old memories before when I was in your places and where I lived before, where I studied before. So I last week I spent all there in Saint Petersburg, and we had a good time to meet my Russian friends. They invited me everywhere. We spent a very good time. I have shown them some surgeries. I did like a workshop there also. And I'm planning to do this workshop here and next Thursday for in surgery for doctors here. It will be on Thursday and Friday I'm going back.
Another contributing question. If Pakistan belongs to the European Union or Asian Union?
No, it's not European Union. Why European Union? It's not European Union.
I think they gave you I think they made the European Union to make broken to Russia.
Yes, but it is.
They didn't like Russia.
Yes, all the time there are conflicts,
All the time
but
it's a problem.
yeah, it's a political issues. But what is the difference for you? Which part? Anyway, you are not going to Europe. I know when I lived in St. Petersburg, we had Finland just very close to us. We used to go by car there. Any other things? So we are just relaxing. We are not talking about medicine. Don't worry. So it is nice gathering today with you, and I wish for you all success in all your life now and the future, and to find a good place for to continue and to work and to have family and children. That is life. This is the cycle of life. So now you are studying an MBBS. Next one is to find subspecialty. After that, to find a wife or a husband. After that, making children. After that, children to the school. After school is university. After that, you are retired. This is the cycle of life everywhere. So
What about your studying this
in
this
Egypt is they have a very good system in medicine. Some places are very strong, like for example in Mansoura University, where I spent 6 months. They are doing good, and they are big operations doing. This is I'm talking about our field in medicine. I'm not talking about other things. Um, they are good. I like the system there also, and they're strong, and they are recognized from many societies, international societies, especially this Mansoura Center. This one also, Al Azhar University, Cairo University. Yeah, Ain Shams, they are good names. So if you have chance to have your subspecialty there, it will be great. Not in Germany. Any other questions? Any other discussion? So you guys, you live in the hostels all in some in one, or good accommodation or not good? 50-50. And what you do on your free time? Studying? I don't believe you. Sleeping. Okay. Huh? What?
is it the door
Uh-huh. Gato with food or gato with for next? Okay. So you have a golden time now. Believe me. You try to use it as maximum and to enjoy your life, but don't forget about your main aim why you came here. Do whatever you want. Spend life good. Life is nice. Enjoy, but don't forget to study hard. And the good thing that you can, the best thing is to manage your time. For example, I have, let's say, these days to study, this half day to go out with their friends, for example. To manage the time is very important. That's also one of my advices. And he started to go to the hospital to assist. That is a great thing. If you can have your chances to do that, also it will be Very helpful.
I think this is offline would be more
With offline, why more difficult?
because I think he's in the second course. Second course finished that digital cancer and treat
See, it depends on your personal enthusiasm, what you want to do. If you want to be a surgeon, you can find now time and go and help and do whatever, uh, because I think some of you ask me there, I have a lot of time. I don't know what to do. That one of the students. Yeah. So it was very strange question. What can I do in my free time? I told him open the internet to study more, go to the library, for example. There are many things to do. So if you have free time, why not to go to the hospitals and to find some kind of work, even it is free. So not the idea to make money, it's just the idea to be a good qualified and to yeah, to gain experience.
Be
Yes.
afraid, okay?
Huh?
Be afraid.
Be afraid? Me?
No, I think, for example, he's going to the hospital. Many time ago, I think he was wanted to take him to the hospital to see what they was removing the stone
For the kidney? Okay, so this urology, my specialty.
and I just get impressed. I can see these things, and when I was in Colombia, it was so okay with me. But when I came here and I saw this like so near me, I was impressed, and I really respect it. That's
Uh-huh.
normal.
It is normal. It is normal because you need to go more and more and more. Then you will forget about these things because maybe it was open case, open surgery, or just open surgery. But he was okay. You didn't fall down.
No,
You just was
I
afraid.
wanted.
It can happen, and I have seen myself for the beginning when I saw some organs, I was feeling bad, but at the beginning only. But slowly, slowly, you will forget this feeling, and you will be more strong. Don't give up. Don't say that I'll be afraid to go.
No, it's because I'm asking because, for example, when I'm in the anatomy department, it's okay for me. I can after this, I can do this. I have to continue with the smell. It's okay for me. But when I saw this, I would. It wasn't for me. Yeah.
Yeah, understand. It is normal. It is normal, and but you need to go more and more. So come Thursday, I will be doing the cases. You will be able to see if you like to the clinic. You just see the schedule, and you will come. I will be doing one case, and the Richter will be doing other case in second OT. So you
In
can.
real life,
I think yes. I think yes. But if anybody wants to come in, you will come. I will be doing the stone cases in my way, which I am doing without any incision. Unfortunately, I have a lot of videos here, but I cannot show you. Actually, I give you a little idea about that. That's what we call flexible ureterorhinoscopy. What that means a special device like a small tube. Okay, we go from the urethra to the bladder, after that to the ureter, after that inside the kidney. So I can make, because it's a flexible, I can control the tip of this device inside the kidney, and that device I can find anything inside the kidney. I can do any surgery I want inside the kidney without doing any cut. So mainly we do for big stones inside the kidney. So from that device, when I see the stone, I introduce my laser fiber inside. Then I can see everything on the monitor. Okay. Then I start to break the stone by laser and take all the fragments out. So you remember maybe like 20 years before, we used to open the patient, big incision, and do this surgery. Now we do it very fast and very easy. And in India, by the way, they are the best in this field because India very endemic area for the stones. and I had my training there for this. This we call the surgery called RIRS, retrograde intrarenal surgery. I am one of the few people in UAE doing this surgery. I can show you videos if you come to me after this. So you don't need to see blood, you don't need to see incisions, you don't need to see bleeding. There is no scalpel at all, and this is very high skilled surgery.
But as surgeon, you should be able to do this also like on time.
Yeah, of course, because any of these operations, if you do it laparoscopically or endoscopically, you can have any complication that you need to open, and immediately you should be ready for to open. Yes, for example, you did something and there is a bleeding, for example, which you cannot stop. You should be ready, and your team should be ready and prepared to open immediately. Other patient, you will lose the patient. Yes. So, and the prostate surgery also we do nowadays. When I was in Russia here, we used to do open surgery. I've done a lot of big number. Nowadays, do zero number of open surgery. We do all endoscopically. So there is no any open. The open surgeries nowadays maybe like 1 to 2%. All now laparoscopic and endoscopic. Yeah. So this is the advances in the medicine. See, if you compare the advances, for example, in the technology or in telecommunication, for example, you see they are going fast. For example, yesterday they had iPhone 12, they are going to iPhone 13 next year. The advance is very fast. But if you compare it with medicine, the steps are very slow. Yes. So the latest thing in medicine now, what we see, the robot. But still the robot we have to put inside the patient. We are expecting for the new generations different type of medicine. To be honest, this is my imagination. For example, he came with pain here that I can diagnose him, in a few seconds. I can find the problem, I can treat him and let him go. This is I'm talking about future. So this is my personal imagination. What is going to happen, for example, after maybe 20 years, maybe 50 years? Nobody knows. But the steps are very slow. Unfortunately, it's like that. Anyway, it was nice to see you again and to have this warm discussion. And almost I wish you success and great life. And if any time you have any queries, I think many of you that are following my Instagram, so you can see me there, and I'll be happy to answer. Urologist dot doctor dot imad. Urologist dot. If for anybody who doesn't have, urologist dot doctor dot imad starting with I. Okay, you found it? Okay. So we'll see you again tomorrow for year 4. I think tomorrow we have lectures, topographic anatomy, surgery, urology also. I'll be happy to see you again. I am available till 10th of this month. Till that time, anytime you can ask me anything you like. Even after, you're welcome anytime. All the best.
عندك هنا